The germ theory of disease is probably the greatest paradigm shift in thinking we've ever had. In 2007, 11,000 readers of the British Medical Journal were surveyed to answer the following question. What is the greatest contribution that medicine has ever made to humanity? It was public health sanitation. That was number one. Number two was antibiotics. Number three was anesthetics. Number four was vaccines. Number five was the structure of DNA. And number six was the germ theory of disease itself. So consider, of the greatest contributions ever made to humanity, 4 of the top 6 are either the germ theory of disease itself or contributions that were a direct result of the germ theory of disease. And that's one of the things people don't recognize, that our concept that microorganisms cause human disease is only about 150 years old.
Welcome to the Work for Humans podcast. This is Dart Lindsley. What does it take to overturn centuries of accepted wisdom? And why is it that the most important breakthroughs often take decades or even generations to be accepted? My guest today is Dr. Robert Gaynes, an infectious disease physician and professor at Emory University, where he teaches courses on the history of medicine. He's also the author of Germ Theory, Medical Pioneers in Infectious Disease, a book that traces how medicine evolved from ancient ideas of humors and miasma to the germ theory of disease. In our conversation, Dr. Gaynes explains what qualifies as a paradigm shift and why resistance is so strong, even in the face of solid evidence. He also shares shifts he's witnessed in his own career, from ulcers being redefined as bacterial infections to today's breakthroughs in the microbiome and precision medicine. This is a conversation about medicine, but it's really about change. Why new ideas struggle to take hold, how the personalities of innovators shape acceptance, and what happens when a powerful new paradigm leads us to overcorrect. If you've ever wondered why introducing a new way of thinking can feel impossible, history has lessons. It can be done. And Dr. Gaynes brings those lessons to life. All right, if you enjoyed this episode, don't forget to subscribe so you don't miss the next one. And now, here's my conversation with Dr. Robert Gaynes. Robert Gaynes, welcome to Work for Humans.
Thank you very much. Pleasure to be here.
This interview is one in a series that we are doing about large systems change and how large systems change happen. And a lot of the work that we talk about on the show is suggesting a paradigm shift in how businesses run. And so I really wanted to talk to somebody who is an expert in a paradigm shift. And one of my favorite paradigm shifts is the shift from the miasma theory of disease to the germ theory of disease. And you've written the book on that. So let's just start by asking the question, what do you feel counts as a paradigm shift?
A paradigm shift is a fundamental change in thinking, in an approach, or in an underlying assumption. And in medicine, if you follow the media, you'd think that breakthroughs happen every week. Actually, fundamental changes in medicine are comparatively rare. They occur maybe a couple of times in one's lifetime. They're not something that happen as frequently as the media would lead you to believe.
And you teach this to medical students at Emory. Why do they need to know about paradigm shifts?
Well, actually, I teach courses and seminars in the history of medicine. Even though I'm an infectious disease doctor, it is an important aspect to understand, and I usually discuss this right at the beginning, which is really to help answer the question, why even study history? Historians can spend hours talking about this. They can write papers, even books on that subject. And I don't want to belabor the point, but I always tell the students, my 3 reasons for looking at history, in this case, history of medicine, are 1, just education. I used to say 90%, I think it's more like 99% of practicing physicians have absolutely no idea of the history of their own profession. So that's one. The second is to understand why we are the way we are. Things like Why at the graduation from medical school do we administer the Hippocratic Oath? What was its meaning way back when, and what does it mean today? Why in Europe do you go from their equivalent of our high school directly into a 6-year medical school program? But here in the United States, you go to college and then you go to medical school. Why is that? Well, there's reasons if you look back at history. But I think the most provocative answer to why study history, as they say in this case, history of medicine, is it goes directly to how does change occur in medicine? And this is not an issue simply, and I tell them this, simply of academic interest. Because at some point, no matter what field of medicine these students go into, at some point in their career, there is going to be a paradigm shift in thinking over what they were taught in medical school, something they thought they already knew.
Have you experienced such shifts yourself in your career?
Absolutely. As I say, there aren't many, but there have been a few. And the one that I always cite to the medical students is that what I was taught in medical school about peptic ulcer disease, totally wrong. And during my career, I watched as these two Australian physicians tried to convince a very skeptical medical world that peptic ulcer disease, thought to be a chronic disease, was actually caused by this bacteria ultimately called Helicobacter pylori. And I remember during my career, I knew gastroenterologists who treated patients with ulcer disease. And I remember their initial response was, oh, that's crazy. And in a few years, they went from, no, that's what we should be teaching everybody. And the reason I tell this one to medical students is that by looking back at history, there are multiple examples of major paradigm shifts. Some of them were accepted immediately, but many of them were not. And in my courses, I discuss some of the greatest contributions ever made to medicine. And it surprises the students sometimes as to how much the contributor was attacked by their contemporaries for their ideas. And I said, how open are you going to be when this paradigm shift starts to hit you in the face? And some of my medical students will end up being the discoverers of some of these paradigm shifts. How will you convince your contemporaries that your approach is correct and that what they thought they knew was wrong? Those are things you can pick up by looking at the history of medicine. Now, aside from the H. pylori and peptic ulcer disease, that one was really major because not only did it attack what was thought to be a chronic disease, but it led to the possibility that other diseases might be triggered by microorganisms. And there's now substantial evidence that various cancers, rheumatoid arthritis, type 1 diabetes, hardening of the arteries or atherosclerosis, Alzheimer's disease, multiple sclerosis, and even schizophrenia may be triggered by certain microorganisms. Another one that I can certainly cite in my career is the issue related to HIV and AIDS. I suspect you remember in the 1980s that HIV, or if you were diagnosed with AIDS, which at that point was often a clinical diagnosis, there was no blood test until they discovered the organism. In fact, I remember vividly this story because I was taking care of the brother of one of the interns. This is when I was a resident. And I was in his room watching TV, and some woman from the CDC was on talking about the modeling they'd been doing in patients who had AIDS. And I'll never forget this. She said that our modeling shows that if you're diagnosed with AIDS, the mortality at 4 years was 100%. And I will never forget the look on that patient's face when he heard that, because he had been diagnosed with AIDS at that point. And I had no words for him at that point. And what is most amazing about it is that, particularly starting in the mid-90s and going up to today, now, for example, you can take one pill a day. And if your viral load is non-detectable, that same modeling shows that your lifespan with HIV is the same as people who've never had HIV. So we took a 100% fatal disease and made it completely treatable. And that has been a evolution in our thinking about HIV. The microbiome is also another major shift in thinking. And in areas that I've not been directly involved in, certainly cancer, both diagnosis with molecular and genomic medicine, targeted therapies or precision oncology, and immunotherapy with things like immune checkpoint inhibitors. All of these have been major changes in the way cancer has been diagnosed and treated compared to what I first learned in medical school. So those are the ones that I've seen in my career.
I can see why it's important. Sometimes when a new paradigm comes along, it offers enormous benefit. And delays in the acceptance of that new paradigm come at enormous cost. And so, what was the transition from miasma theory to germ theory? And then, what were the benefits?
Well, the miasma theory was not a direct theory. We have to go, and this is something that I discovered as I started to write the book. In order to understand the importance of the germ theory of disease, you had to completely understand the theory that it replaced. And the theory that it essentially replaced went all the way back to the ancient Greeks, to the time of Hippocrates. And that was the theory of four humors. And this is one of the great paradigm shifts in medicine. Prior to the ancient Greeks, if you had an illness, you would go to a place called an Asclepion in ancient Greece, which was sort of a temple/hospital. You would literally sleep in there for several days, and you would tell your dreams to the physician/priest, and they would commune with the gods and tell you what you needed to do for treatment or whatever. But the fundamental aspect of that, and a lot of other cultures have this, is that you needed to commune with the supernatural, with the deity. And the ancient Greeks said, no, disease has a natural cause, and therefore it can be studied. Now, their approach to the theory of disease was the fact that they thought we were all combined with four fluids or humors. There was blood, yellow bile, phlegm, and black bile. And we all had a various mixture of these. And the mixtures would sometimes produce your personality. If you had a little more black bile, you tended to be a little more depressed and introspective. And if you look back at some of the words that we have, like melancholic, it actually means black bile in ancient Greek. So many of our notions about our personalities comes from the thinking about if you're composed of a little more black bile than someone else, or, if you're more yellow bile, you're choleric or quick to anger, those sorts of things. All that comes from the ancient Greeks. But the theory of disease was that if these humors got out of balance, then you became ill. And the role of the doctor was to get them back into balance. So that theory hung on for a remarkably long period of time.
2,000 years, right?
Yeah, more than
2,000
that.
years.
And that's where the miasma part comes in. A holdover of the humoral theory of medicine held on into most of the 19th century. So let's go back to how the germ theory of disease replaced this concept. First, understand, at least for fevers and things that would suggest infectious diseases. So in the ancient Greek world, they did not do human dissection. So their knowledge of internal anatomy was really rudimentary. And one of the things they recognized was the heart did something. They didn't recognize that it was a pump until centuries later. But during the time of Hippocrates, they thought it produced something called innate heat. They knew human beings were not ambient temperature and that we had more heat than the environment. So what happened if you got a fever? Well, the idea then was something has changed to your body producing too much innate heat. And one of those humors, blood, was responsible for taking from this furnace that they thought was what the heart did, taking that innate heat and bringing it around to the various tissues of the body. But if you had a fever and therefore too much innate heat, how would you bring back the balance? Well, the answer was bleeding the patient. There were other reasons to bleed patients over the years, but that was the fundamental reason that people were bled over the years. And to show you how long this theory lasted, In 1798, our very first president, George Washington, 2 years after he completed his presidency, was working around his Mount Vernon estate, and he developed some sort of febrile illness. It was something in his throat. He may have had a retropharyngeal abscess. It was called quinsy at the time, but it's not entirely clear what went on. But he had a fever and took to bed. And 3 different doctors were brought in. Each of them bled him in 24 hours over a liter of blood. Now, a man of his size probably had about 8 liters of blood in his body. And in a period of 24 hours, they bled him half of his blood volume. And I remind medical students that if somebody is going into sepsis, it is not a good idea to remove half of their blood volume. And it's very likely that the doctors, rather than the disease, killed George Washington. By the way, I wish that was the last time the doctors did in one of our presidents, but frankly, it isn't. But that shows you in 1798, the theory that was developed 200 years earlier was still in practice.
And so it seems to me, anyway, that a plausible wrong idea can be more difficult to displace than no idea at all. And I'm wondering if when you read about humoral theory, for instance, whether or not, even knowing what we know today, you can imagine it being plausible.
There were some things that did work. There are a couple of reasons that it stuck around as long as it did that has nothing to do with their plausibility. The first is that after Hippocrates died, a lot of sects developed with some different changes in thinking from the humoral theory, but they all were basically relying on that as a theory of disease. And in the first century, a man who practiced mostly in Rome, a man named Galen, thought these different sects were a terrible idea, and he wanted to bring them together under one common theory of disease and practice, which of course was his theory of disease and practice. And Galen, for his time, was a very smart guy, and he did a number of really good things. But one of the things he did that was absolutely disastrous for medicine was he literally wrote that no further research was needed. All you had to do was know medicine by reading what I've written. And he left us, unlike the ancient Greeks, where we don't have a lot of ancient Greek texts from that time. He was a prolific writer and perhaps the most arrogant physician that's ever lived. And there's many examples in his writing to see just how arrogant and egotistical he was. But unfortunately, medicine drank his Kool-Aid. And it is a true cautionary tale because for the next at least 1,500 years, it was believed to know medicine was to know Galen. In fact, as the Middle Ages and the Christian church became very prominent, if you even criticized Galen, if you even said something like, I don't think Galen was right here, you could be accused of heresy and excommunicated, which you might imagine might have a chilling effect on any progress. So that is one of the reasons that this theory that was developed about 450 BCE hung on until well into the Renaissance. And really, it took another couple hundred years to get rid of this idea that we needed to rebalance humors as treatment. Now, you brought up the idea that there's some plausibility in what they did. And the plausibility came in a couple of areas. One was there were gradations in treatment. Most of what the ancient Greeks, and Galen as well, promulgated for treatment was relatively minor considerations. You know, improve your diet, get more rest, eat better, those sorts of things. And you would eventually get better. And most patients, when they come to doctors, will eventually get better for what they came for, even if the doctor didn't do much. And so they seem to recognize that. But there were more heroic treatments that were advocated, bleeding being one of them. But those were used relatively rarely. So a lot of times there was a lot of faith. And one of the things that the ancient Greeks did, which we owe them a good debt for as well, was that they were the first to really sit down and try and understand some symptoms, and they shared information. And when patients would present with certain symptoms, they began to recognize things that were going to be fatal or not fatal. And they shared information amongst each other, the Hippocratic. So they began, while they weren't very good at diagnosis the way we would consider it, they got reasonably good at prognosis. You're going to live, you're going to die. And that gave them a great deal of credibility. So that if you came to someone with yellow eyes and other symptoms that we would recognize today as, say, hepatitis A, they would know by sharing this information with other Hippocratic physicians that, hey, you're going to be better in about 4 weeks. And you were. So the ancient Greeks could go to these Asclepions and have their dreams interpreted, or they could go to a Hippocratic. And there was a lot of credibility. So that was one area that helped keep this humoral theory going for as long as it did. And the other is that what was it that would get your humors out of balance? And remember, that was a process that was entirely internal to the body. But there were external forces that could help get things out of balance. And one of them was this stuff called miasma. Miasma was this ethereal stuff, never particularly well explained, by the way, what it was. Some ethereal stuff that came from decaying matter. That was miasmata. But miasma was in the air and it was ethereally, and somehow it would get into you and it would alter your humors. For example, the Romans recognized that this miasma might be coming from various places. And in Roman times, malaria was common in Italy. And since they thought that the miasma was coming from swamps, the Romans drained the swamps, not recognizing the fact that the vector that was getting the malaria around to the people in Rome or various areas in Italy was a mosquito that when they drained the swamps, the mosquitoes went away and malaria improved. In fact, if you look at the word malaria and separate it out, it's malaria, and that means in Latin, bad air. So the Romans fixed something for the wrong reason, but they had the right ending. So those were a lot of reasons that helped keep this theory of disease, which we would think we would have dismissed long ago, around for so long. There was the authority of Galen and the fact that the treatments generally were pretty innocuous. There was only a few really heroic or Hippocratic, is what they called it, treatments. And that more than occasionally they did the right thing for the wrong reasons.
What's going to be so important for us in this conversation, I think, is what are the conditions that led to being able to challenge that theory? One of the things I've noticed it in other areas, but also in your book, is that there was a tendency to trust the ancients, that the place to look for wisdom is in the past, as opposed to the place to look for wisdom is in the future, I suppose. So that seemed like a fundamental habit. Let's look to the Egyptians for wisdom, or let's look to the Greeks for wisdom. And the older it is, the less you might doubt it. But what were the conditions that led to suddenly starting to challenge the theory?
So first I would caution in the word suddenly in medical theory, because breaking down the theory of humors took centuries. And that was an essential element in getting to the germ theory of disease. And it really came in two parts. One was getting rid of the humoral theory, and the second was getting rid of that holdover from the humoral theory, the miasma thoughts. So the first step was getting rid of the humoral theory as a theory of disease. And that took, as I say, centuries. It was promulgated mostly because people didn't want to challenge Galen. And as I say, it was, as you'll see in my response to what happened, some of the people who did challenge him starting in the Renaissance suffered greatly just because they challenged him, not because they were wrong. And you'd think why would somebody get so excited about challenging this man? And I can't really answer that other than the same response if you tried to challenge today the Bible, that whatever this is in the Bible is totally wrong and I'm challenging this, you would get a backlash. And that's what happened when you challenged Galen. That was probably the major inhibition to progress. The first real step in this was in the Renaissance. It's funny, you talked about the reverence for the past. The Renaissance was really a period where the past was considered something that had great relevance, and they found great comfort in looking back to the ancient Greeks, which had been lost for many centuries in the Middle Ages. But what a man in Padua, which is a town about 20 minutes outside of Venice, did was he was the first person to do human dissection himself. For centuries, human dissection was done by the professor reading from Galen's work. And there would be these barber surgeons in the very few human dissections that were done who were untrained, who were simply there to show how right Galen was. And it wasn't really to learn new things. And when he started doing his own dissections, he began to have this really disquieting feeling that a lot of what Galen had written was wrong. And the story goes that he became a very popular professor in Padua and was invited to nearby Bologna to do a dissection by the students. And their professor, a man named Corti, was reading from Galen. And he was doing the dissection, and the professor was reading, and he came across this bony structure, and he was listening to what the professor was reading. And he realized that what Galen was actually describing was this bony structure from an animal, not from a human. And it hit him. He realized that Galen had never done a human dissection. It was forbidden in ancient Rome. Although Galen never says this, he had inferred animal anatomy as human anatomy. And that was the point where Vesalius said, this needs a book. So he went back, and with the help of an artist, they produced this magnificent book, which was the first accurate book on human anatomy. And he corrected about 200 errors that Galen had made. And it was a beautiful book. It's a large book with about 11 or 12 full-page illustrations, which are remarkably detailed. It's really gorgeous. In fact, I get to teach from this book because Emory has one of the 60 or so surviving copies of it. And it's one of the highlights for the students. They really enjoy seeing it. But you would think that here he is, he's produced this beautiful book, and there's an English translation where you can read how he challenged Galen. He was very gentle in his criticism. Galen may have inferred too much from the apes. Something like that is the way he says it. And you'd think, hey, great, we got this great book now. He was attacked by everybody. Students attacked him, his faculty attacked him, and even this professor from the University of Paris, who had been his anatomy teacher when he was training there, sent a letter to the Holy Roman Emperor just lambasting Vesalius for doing this. And he was so angry about this reaction as that he resigned his post. Now, as I say, this is not the kind of criticism of Galen that people would say, hey, he did it, so I want to do it. So he really suffered for this. Now, he'd lived long enough to see that his book was eventually accepted, but it took a full generation for people to realize that one of his watchwords was, believe that which you can personally observe.
There's two things in there. One is what started to challenge it, and what challenges old ideas is just look. Just look. Don't trust received wisdom. Observe. And to some extent, that was made possible because some cultural norms that said you may not look inside a human body had been weakened.
Both the things you said are absolutely true. One was the church, which had a hold on whether you could do a human dissection or not. It was usually up to the local bishop as to whether what they were doing was fine. But they realized that the two groups that wanted to do human dissection at that time were the doctors, of course, but there were also the artists. And the artists gained a lot of information from watching these dissections. And the church, of course, was the recipient of some of the great art that resulted. So the church began to soften its hold on whether you could do human dissection. The other aspect that is evident in the book that Vesalius produced is it also was a dissection guide. So he was essentially saying, hey, if you don't believe me, here's how you do the dissection, and you'll see exactly what I'm saying. And that was also part of the genius of his book, which is probably the reason after a number of years following the attack on him, that it was eventually accepted because it was very hard to argue. You do it, oh, yeah, you're right. This is this way. It's not what Galen said. That was one of the great changes in approach, but it didn't dismiss the humoral theory altogether. It just said that some of the things that Galen wrote about anatomy were wrong.
Just introducing doubt.
Exactly. And that, by the way, is why historians generally give the name of it in Latin is De Humani Corporis Fabrica, or on the workings of the human body. They give the emphasis that this is perhaps the most important book ever published in medicine because it did exactly what you just said.
So it opened the door to doubt. And you're right, by the way. Yes, I did talk about it as happening suddenly. It seems like it happened suddenly with Louis Pasteur, but the truth is there's so much that leads up to it. What happened after Vesalius that continued the path?
So the next real change in thinking is the work of William Harvey. He solved a problem which really at the time was kind of like what we talked about with Helicobacter pylori and peptic ulcer disease. Galen had described how blood flows in the body, and he got it totally wrong. But everybody believed him because he wrote it. And Harvey went through a process where he figured out that the heart is actually a pump and what it does. I won't go into the details because he wrote it beautifully in his book. De motu cordis is the way the historians refer to it. But it was what it really did, the broader significance of what Harvey did was he introduced the scientific method into medicine. And that was probably the greatest contribution. Vesalius said, believe that which you can observe. Great point. But when you start adding in the scientific method, and remember, Harvey was working in the age of enlightenment when everybody was questioning everything. That really was a major leap in the way medicine viewed research and progress. And that was the next real step in the way the body worked, because you could experiment in a scientific way about it. And he was really the first, and he was a brilliant example of how you apply the scientific method to a biological circumstance. He did it extremely well. So that was probably the next step. But probably, I talked about the declaration of independence from the supernatural that the ancient Greeks did. That was probably the first paradigm shift in medicine. Because how can you know what the gods know? But if it's a natural cause, you can study it. And that allowed progress to even happen in medicine. Vesalius added doubt, as did in some ways Harvey, and introduced a way to get beyond some of the approaches that Galen had written about. But I think the next real change in thinking was a change in the theory of disease. And that occurred in the late 1700s through a man that I've been mystified why more people don't know who he is and what he did. And this was a man named Giovanni Morgagni. He also worked in Padua most of his life. And what he did, he was like 23 years old, and he was doing essentially autopsies to learn more about anatomy, but he had an individual brought to him. He was a 72-year-old man who about 2 weeks earlier, according to what he had heard from family and friends, had a pain that started around the belly button, around the umbilicus. It was associated with some vomiting and didn't really feel like eating that much. And then after a few days, the pain migrated to the right lower quadrant of the abdomen. And the pain became more and more severe. He began to limp on his right leg. And eventually the pain generalized through his entire abdomen. He was febrile, very sick. He stopped urinating and eventually died. Now, you've heard this. Do you have any idea what Morgagni found when he did the autopsy?
My first thought is a burst appendix.
Exactly. And how do you know that?
Well, I have an image in my mind of what's going on in that part of the body because of various drawings of it from anatomists. I wouldn't have thought it would start at the umbilicus, but it's certainly in the right location.
So the real answer to the question, how do you know that, is that somebody spent some time correlating the symptoms.
Yes, that's
With
true.
what they found at autopsy. And that is what Morgagni spent his entire life doing.
That's right.
And finally, in 1761, he wrote this book. And he was the first, for example, to describe that if somebody had classic angina pectoris, this was the classic story of a heart attack where a man holds his fist over his chest and feels like an elephant is pushing on it, that symptom, when he does the autopsy, there are clots in the coronary artery. Somebody who has a sudden loss of sensation or ability to move their left or right side, do the autopsy, in the cerebral blood vessels, there are clots or changes in them that they're associated with stroke. All of these things are things that Morgagni found and correlated the symptoms with these findings at autopsy. So he wrote a book that in English is called The Seats and Causes of Disease as Demonstrated by Pathologic Anatomy. And if you look at that first story I told you, when he did the autopsy, he opened up the body and there was generalized, as you said, a burst appendix, and it was just a mess in the belly. And he's looking at this thinking to himself, this is not an imbalance of humors. There's something dreadfully wrong with this man's anatomy. And that was the real change that occurred as a result of his book. And unlike his predecessors, Harvey and Vesalius, he was not attacked for his book because the book was utter genius. And there's a lot of reasons for that I don't need to go into, but it was genius. And he was a very well-respected individual through his lifetime. He had done a lot of work and everyone had tremendous respect for him. He actually marketed his own book where he had so many connections throughout Europe that he sent his book around to all the various medical schools and the people that he knew there, and they saw the genius of it. But it took about a generation because a lot of doctors were trained by an apprenticeship. So it took a generation or so to get this change in thinking to occur, that the idea are that a patient's symptoms, and this is Morgagni's words, symptoms are the cries of suffering organs. And as after the French Revolution, the Paris School of Medicine, which in the first half of the 19th century was the dominant, it was the center of medicine. And they added not only symptoms, that's what the patient complains about, but the physical exam to the idea that if you put together a patient's symptoms and what the doctor finds on the physical exams, then you can predict what we find at autopsy. And they had a system in Paris which allowed for better and better and better diagnosis. And that really completely blew away any notion that the approach to disease is the humoral theory, that it just completely went away during that period of time. However, the one holdover was miasma. Now, in the first half of the 19th century, as things were getting better and better with diagnosis, you have to remember that almost all of this was done without the use of the microscope. Doctors had very little need or consideration of the microscope. All of this changes in pathologic anatomy was done with the naked eye. And down around, 30 years into the 19th century, they began to refine the microscope. The microscope had been invented at the very end of the 16th century. And there was one individual in the 17th century, Anton van Leeuwenhoek, who created a microscope, a single lens microscope with sufficient power to actually see microorganisms. He was, without doubt, the first person to ever see bacteria, which he got from the gunk in his own mouth. But his microscopes were exceedingly difficult to use. They were a single lens, but there was a little metal plate about 2 or 3 inches, and there was a hole in the plate. And he would make a lens that would fit in that hole. And then on the opposite side from where he was looking, he would have a pin that he could adjust up and down with whatever he wanted to look at. The focal length of this lens was so short that you literally almost had to put it right up to your eye. And you needed exceedingly good vision and infinite patience in order to see what was going on. And even though he had described bacteria in the 1600s, it was from his own mouth. They weren't bothering him. And it was largely dismissed because, one, doctors didn't use microscopes. They were hard to use. Also, by the way, he kept a secret as to how he made his lenses. He was a businessman, and he didn't have this scientific approach that everybody needs to know how to use this. I wanted to keep this for myself, was his thinking. That's kind of the way businesses think. So most of his work was forgotten. And it wasn't until things started to change, both with the microscope and in thinking in general. In the middle of the 19th century, a man named Rudolf Virchow began to apply the compound microscope with 2 lenses to looking at tissue, looking at both normal and abnormal tissue under the microscope, and essentially invented what we recognize today as the field of pathology. And it followed the cellular theory in general, which was every living thing is made up of cells. So he took that to the next level. And all of this laid the groundwork for the germ theory of disease.
On Work for Humans, we've been exploring the principles of multi-sided management, which is the belief that work is a product that every company designs, builds, and delivers to employees. Along the way, people started asking how they could put these ideas into practice. So I founded the work design firm 11fold to help your company create the kind of work that makes teams feel alive and engaged instead of dead and dull. So you can reduce turnover and build commitment. We're doing something revolutionary here. Learn more at 11fold.com. That's 11fold.com. So there's a couple trends in there that I want to call out. One is what Morgani did was he started talking about correlation analyses, essentially, of subsystems and the symptoms of disease. And I think it's better than doubt. I mean, doubt's good, but then starting to actually think about correlation between evidence and disorder, it's a huge thing. And then the invention of instruments that made it possible to see bacteria is more of just look. It's just now have tools to look and you can see more. But I have to say, when I think about the outrageous nature of the claim that invisible animals are killing us, the miasma theory, the humoral theory is much more plausible to me than the idea that, no, I've never seen these animals before, nobody's ever seen these animals before, but guess what? They're killing you. It seems like an outrageous claim and a hard one to get across.
In some ways it was initially, but remember another thing about what Morgani and the School of Paris did, which was they began an idea where symptoms are the cries of suffering organs. Symptoms are different if you have problems in your lung compared to if you have problems in your liver. So it began the concept of disease specificity, which is completely against the holistic approach that the humoral theory had, which is that you're composed of these 4 humors and just get them back into balance. It's all the whole body involved. It had no disease specificity in and of itself.
It treated the body as a black box, essentially.
Exactly, but it also treated it as though there was no specificity. If you had a fever, it was just get rid of some of the blood to get rid of that. It didn't matter what caused the fever. And as time went on in this disease specificity that started with Morgani and was really brought to greater detail in the Paris School of Medicine, was the idea that disease can be located in one organ with specific symptoms. And where this becomes important is when the germ theory starts to take hold. There are a variety of different microorganisms. And the idea that one microorganism can cause one problem compared to a different microorganism that would cause a different problem goes directly back to the idea of disease specificity. And that's one of the things that eventually, starting around 1890, made the germ theory of disease something that was embraced very quickly because it had an explanation.
That's so recent.
It is. And that's one of the things people don't recognize, that our concept that microorganisms cause human disease is only about 150 years old.
My grandfather was born in 1893. So it's already 40 years before antibiotics.
Absolutely.
So what was, because I agree that it took a long time to get there, but it seems like once we arrived at a certain critical mass, that things happened pretty fast starting in about 1890.
Well, it was a little earlier than 1890. I would say that the work of Pasteur, if you look back at what he started, was really in the mid-1850s. And prior to that, there were some things. We talked about the development of compound microscopes. And one of the very first things that Pasteur ever got any acclaim for, because he was trained as a chemist, was using the microscope in a chemical analysis. So he knew how to use the microscope. We talked about disease specificity during that period. There was a man in Paris named Claude Bernard who did a lot of work in experimental medicine in the laboratory, and he introduced the concept that the laboratory is important in medicine. And as I've told infectious disease fellows over the years, there is probably no specialty in medicine that's more dependent on the laboratory than infectious diseases. And then there was a man named Jacob Henle, who in the 1840s proposed the idea that living organisms occurred with contagion. But he didn't really have any means at that time to determine which bacteria was which and how this all worked. So all of this sort of led up to the time when Pasteur, who, as I say, was a chemist, was working in Lille. As a father of one of the students had a industrial fermentation plant. I can't remember what he was making.
Beer.
It was beer, I think, yeah. And his vats were putrefying. And at the time, believe it or not, fermentation was thought to be an entirely chemical process. So if you have a problem, who do you go to? You go to a chemist. So he brought the material of these putrefying as well as the vats that didn't to Pasteur, and Pasteur used the microscope in the ones that were operating correctly, fermenting the way they wanted. He saw yeast, but in the ones that were putrefying, he saw bacteria. And he called this the diseases of fermentation. Now, interestingly, Pasteur was not a physician. He was not trained in that way. So he had a different, unbridled approach to what might be going on.
Thomas Kuhn, in his book, The Structure of Scientific Revolutions, he talks about how often the people who bring a new paradigm into a discipline are from other disciplines. And I can feel this tension at the time, which is, why are chemists telling us anything about medicine? Why are people in labs? If I'm a medical doctor, why are people in labs? They can't possibly know what I know about treating patients. There's scientists off in, the ivory tower. So I can feel these tensions in that.
Well, those tensions occurred in Pasteur's lifetime. And frankly, those tensions still occur. Over the years, I've worked with a lot of PhDs, and, I can't blame them for this. They are somewhat jealous sometimes of doctors and feel that they don't understand the research, that the way they approach it, and some of that may be true. Physicians often don't think that PhDs have a concept of disease because they're not taught it. They're PhDs. They didn't go to medical school. You don't learn about disease that way. So that tension still exists a little bit. But I agree with you that that tension was definitely present. The thing that really separates Pasteur, though, is that he figured out a way, practically, to deal with the problem he was presented, which is he recognized by cultivating these microorganisms in his lab, the first microbiologist, if you will, he recognized that if you heated the vat, if you will, up to 55 degrees centigrade, you could kill the bacteria, but not the yeast. And what do you suppose we call that today? Pasteurization. So he developed a practical means to deal with the problem he was presented. He did a work on silkworms. Silkworms were dying off and they didn't know why. And again, he used his microscope to find that there are actually two, but he found diseases that were caused by microorganisms. And again, practically found a way to separate the diseased silkworms from the non-diseased silkworms and basically saved the silk industry in southern France. Now, one of the things that he had to deal with was the concept of spontaneous generation. In other words, you find microbes, where did they come from? And there were a lot of people who believed that if you just mix some inorganic material together, leave it around, I can make microbes. That's spontaneous generation. Now, this became a real flashpoint early in Pasteur's career. And it can even get into the metaphysical because ultimately, at some point in Earth's history, microbes did not exist, and then they did exist. So at some point, somehow this happened. What Pasteur was really good at was breaking down somebody who claimed they had spontaneous generation in their experiment in the lab. He would show the flaws in the experiment and show that it got contaminated through some other ways, and this was not spontaneous generation. And he managed eventually to convince the scientists of Europe that spontaneous generation didn't exist. And, if you stop to think about it, you couldn't have germ theory of disease if spontaneous generation of microorganisms happened. I mean, we're all, organic material. And if spontaneous generation happened, we'd all dissolve into a pile of bacteria. And so his work in this area was really an important one to put that idea aside. Where he got into the most trouble, I think, with the physician community was when he started working on vaccines, because he recognized through a rather serendipitous experiment that you can attenuate the virulence of a microorganism, but if you attenuated the virulence, you could still make it something that would produce immunity in the organism, in the animal. And he developed an approach to a variety of vaccines. And it's still largely the approach we've used in vaccines in general. Where this got really tense was in the fact that he had a rabies vaccine. And he was presented with a young boy who had been bitten very severely by a rabid dog. And he agonized for days as to whether he should try his vaccine, which he'd only tried on animals, on this boy. And ultimately he did and was attacked by the physician community. Fortunately for the boy, he survived. But that was probably the high point of the tension that he exhibited in his lifetime.
I have to say, reading Pasteur, about him in your book, he just hit home run after a home run. His batting average was extraordinary. And it still took him, and almost everybody that you describe, it takes at least 10 years for people to be accepted, usually, and oftentimes a lifetime or longer, or a generation. But he was such a beautiful experimentalist. He was so good at designing an elegant experiment. And he was lucky to start off with, I think, simpler models than humans in silk and in beer that gave him a way to deal with a system that's much less complex than a whole human and find a model that could be brought over. But man, was he just incredible in terms of what he did.
Students have asked me why he didn't win a Nobel Prize, because frankly, from his work, you could postulate he could have won 4. The simple answer is that he died in 1895, and the first Nobel Prize was awarded in 1901, and you cannot give a Nobel Prize to somebody that's already deceased. That's the rules. So that's why he never won one. But I could make an argument that he could have won at least 4. And you're right. Now, there are people who have written that maybe he stole other people's work and took claim for it. The arguments that I've seen on this are not great, and he may have done something like that, but there's way too much argument available that he did some of the seminal work. And you're right, he hit a lot of home runs. It's an amazing career that he had. And when I talked about this, I gave a course on the history of medicine with a focus on France when it was the center of medicine, particularly Paris, because I taught in a study abroad program for Emory students, and these were undergrads in Paris. And I made a comment that, with the possible exception of Napoleon, I think Pasteur is viewed as favorably as anyone in the history of France. He is revered.
But I also think that there's something there, which is that the moment a paradigm really does flip and you start observing the world through that new lens, there's a lot of greenfield opportunity that nobody has ever tried. And I think I saw the same thing with Hooke and Boyle in the 1600s. Hooke and Boyle just went crazy. And in 20 years, discovered 50 physical laws. They were unbelievable. But that's because experimentation became available to them, because Bacon had written the Novum Organum explaining scientific method. But this idea that, yes, Pasteur found a doorway through with these simpler models, but once he was through the door, there was a lot that could get done.
And there were two other individuals, contemporaries, that really pushed this all forward. So it wasn't all Pasteur. The first one I guess I'd mention would be in Germany, Robert Koch. And Koch produced what has become known as Koch's postulates, which is he, in a period of about 10 years, identified virtually all of the major bacterial pathogens that even to this day affect humans. In 10 years, it was an extraordinary period in identifying very important and specific microbes. And this gets back to that disease specificity. And he developed a series of ways of thinking as to how you determine that bacteria A causes this particular disease. And they became known as Koch's postulates. And in many ways, we still operate on that today in trying to determine, is this the cause of this particular disease? But the person that probably applied what Pasteur did in the most effective way was an English, actually, it was worked mostly in Scotland, but he was from England, named Joseph Lister. Now, Lister was trained not only as a physician, but as a surgeon. And when Lister started practicing, it was only about 20 years after the discovery of anesthesia. And there was about a 20-year gap between the discovery of anesthesia and what Lister did. Now, prior to anesthesia, surgery was just utterly barbaric. I cannot understand how anyone could be a surgeon before anesthesia. It's truly hair-curling to think of what they did. And he was really committed to being a surgeon. And in fact, I think I read that he was in on one of the very first uses of chloroform as an anesthetic agent, and he just saw surgery as a calling. But anesthesia did not make surgery safe. It made it painless. But many people died, even from minor surgeries, as a result of postoperative infection, and he was committed to finding out how to prevent that infection. Well, I mentioned to you that Pasteur was a chemist, and he published his work on the so-called diseases of fermentation in the French literature, in the chemical literature. Now, Lister was brought up in a household where he knew German and French fluently. His father also had solved one of the problems with compound microscopes, so Lister knew how to use a microscope better than almost anybody in England. So he was in Glasgow as a surgeon practicing, and a chemist that he knew handed him Pasteur's work on the diseases of fermentation, which Lister, of course, read. And he said this for many, many years, that he said a flood of light was shown on the problem of postoperative infections by correlating what he saw in the diseases of fermentation into patients. Now, Lister knew he couldn't heat up patients to 55 degrees centigrade, so he looked for chemicals, and he eventually found one. and he began the process of what we would call antiseptic surgery. And talk about a paradigm shift. Not only did that make surgery safer, but it applied the concept that these microorganisms were in causing human disease. It was really the best demonstration of this, and this all occurred around the same time, in this case in the early 1870s. And it was a major shift in thinking. What's interesting, you talked about the 10-year phenomenon, is that in England in particular, there was great resistance to using this so-called Lister approach. And he made a trip in 1876 in the United States Centennial to try and convince American surgeons to use this antiseptic method, and was resoundingly rejected. What really changed the approach for a lot of surgeons happened as the result of the Franco-Prussian War, where French and particularly German surgeons were aghast that amputation, which was one of the most common things they did in the battlefield, had a 75% mortality rate, almost all due to infection, sometimes as a result of bleeding, but certainly infection was a lot of it. And suddenly they had an interest in what Lister was doing. He actually prepared a pamphlet in German and French. The Germans particularly took to it. And when the war was over, they brought these ideas back to Germany. And Lister was frustrated that in his own country he couldn't get the surgeons to do it. And he started getting letters thanking him for his work and how all things have improved. And suddenly French and German physicians were coming to, he was back in Edinburgh by that point. They were coming to Edinburgh to hear his lectures. And he would deliver these lectures in, depending who was in the audience, French or German, just because that's who was interested. And it produced enormous change. And that was something that occurred all around the same time. And it was the combination, I think, of Pasteur's work, the specific microbes in Koch's postulates, and Lister's work that brought it to the point where the idea that microorganisms are involved in human diseases became undeniable.
What were the benefits to humanity?
I would argue that of all the contributions in medicine, the germ theory of disease is probably the greatest paradigm shift in thinking we've ever had. And I would argue that because of, and I cited this in my book, Germ Theory, that in 2007, 11,000 readers of the British Medical Journal were surveyed to answer the following question. What is the greatest contribution that medicine has ever made to humanity? And I don't know, Dart, if you can recall what came out number one.
I can't remember which one came out number one.
It was public health sanitation, and having an appropriate approach to sewage and clean water has probably saved more lives than just about anything else we can point to. And if you don't believe me, go somewhere where they don't have clean water and good sanitation, and you'll see what I'm saying. That was number one. Number two was antibiotics. Number three was anesthetics. Number four was vaccines. Number five was the structure of DNA. And number six was the germ theory of disease itself. So consider, of the greatest contributions ever made to humanity, 4 of the top 6 are either the germ theory of disease itself or contributions that were a direct result of the germ theory of disease. Nothing else in medicine can come close to those 4 things that I've mentioned.
Was there any overcorrection in moving toward germ theory? The reason I bring that up is the miasmists didn't get everything wrong. An example is there are diseases that are not actually tied to germ theory. Diabetes might be an example. Autoimmune disorders of all kinds might be an example. So this idea that there are these other things out there, did we overcorrect at all? Did we ignore those at all?
Probably. I'll explain why I say probably. The reason is that when we discovered antibiotics, particularly when penicillin and its derivatives have come out, they are what Paul Ehrlich was trying to find, the so-called magic bullet, a drug that would affect the pathogen the microorganism, but not the human. And many antibiotics are very close to that magic bullet. They often have very little harm to the individual patient receiving the antibiotic and can be devastating to certain bacteria. Where we may have overcorrected, however, is the overtreatment of individuals with antibiotics. That comes in a variety of ways. One is an example, if somebody has a little bit of an anemia, we don't see physicians going, well, you have a little bit of anemia. You might have leukemia, so I'm going to give you induction chemotherapy with some of these really, really tough agents, just in case you might. And that would probably be considered malpractice. You'd have to do much more work to determine that this patient did or did not have leukemia in order to do that. And that's the way it goes. That thinking is completely different when it comes to treating with antibiotics. You might have some infection. I'm going to give you some antibiotics. I hate to say this, but we saw this very frequently with COVID. When everything said, there was a lot of COVID going around, all the symptoms were consistent with that. Very often, particularly early on, people were treated with antibacterial antibiotics. No really good reason for that, but we did it anyway. So the mere presence of bacteria in many cases caused physicians to give things that got rid of the bacteria. And we've seen a number of examples where we have disrupted the microbiome, is the way we talk about it now. But it wasn't until fairly recently we even used that term. But we have considered that if you get a urine culture and there's bacteria there, we need to get rid of it. And if you're not symptomatic, there's actually incredibly good evidence, with one exception, and that's pregnant women. If you're not symptomatic, there's no upside. And there's a lot of downsides, resistance, reactions to the antibiotic itself, et cetera. And we have overdone the concept that if bacteria are there, we need to get rid of them. And in fact, as you pointed out, as we've understood better the microbiome, that bacteria in many ways are very important for our daily life. And disrupting the microbiome can be very detrimental to our existence. And we need to understand that better. So in that sense, I think we have overcorrected. There are people who have looked back to one of Pasteur's contemporaries, a man named Antoine Béchamp, who proposed something called the terrain theory. And this is a theory that really got no evidence right now, but he was saying that, it's the internal state of the host, their pH, or whatever, rather than germs that are causing the problems. And the germs are just attracted to this diseased tissue rather than the germs causing the disease. And he basically said that bacteria are just there. And many people have glommed onto that in the conspiracy theory world that suggests that bacteria really are not harmful at all, that the germ theory really is wrong. And I don't think that they're correct about that, but I know that there are people who believe that, just as I suspect there are people that believe the earth is flat, but they're in the minority.
Yeah. And so that's another lesson, which is in these patterns of paradigm shift. One is that you'll probably never convince everybody. It's quite impressive what people can believe, and somebody will always believe it. And so I think one of the things we miss, though, when we look at the history of paradigm shift, is we see this through line of the ideas starting to be generated 500, 1,000 years ago, and then them slowly collating, and then coming to a point where Pasteur can actually correlate them and start to open the doors to this. I think we miss how much noise there is in the system and how hard it is to pick out signal. That there were people like Fra Castoro, who you wrote about, who really started talking about contagion as seeds. And he, by the way, wrote a book, an epic poem about syphilis. And I really read a lot in preparation for these interviews. It turns out I have a limit, and I am not reading epic poems about syphilis. But yes, those things might have been written down, but when you think of the amount of the volume of information out there and how they had to part through all of the possible information to find the signal that they could start to turn into a coherent theory, I think it's very challenging.
I would agree with everything you said. I think there are times when we've had a lot of near misses in getting to the germ theory of disease, that people have made proposals. As you mentioned, Fracastoril and the seeds. I mean, the epic poem on syphilis is really what gave him sort of a celebrity status, and not so much anything in the medical end, but he did write a book or an article on contagion and propose seeds. The problem for him was that there was no scientific theory of disease to attach his concept, nor could he prove what these seeds actually were. So his ideas vanished. Probably before he died, there was very little written about it from others. And that's an issue. And I think to some extent, the work that Van Duvenhoek in showing that there were bacteria existed, that also suffered from that. There was no way to attach it to a theory of disease at that point. But it was when Pasteur started to call the diseases of fermentation, and then he really thought that the concept of germ theory to him came to a head on his work on silkworms. He showed that. And then the others took it from there. So I think, as I say, there isn't a single individual that you can say brought the germ theory of disease together, but it occurred at a time where all the elements were there. The one thing that, as I say, sort of hung on was this idea of miasma through much of the 19th century. There were a couple of people who did some things with regard to public health sanitation, particularly Edwin Chadwick in England, who did it on the basis of improving the miasma of London, which I'm sure from what I've heard about or read about London in the middle 1800s, it must have been a place of quite a smell. And he felt that it was important and needed to be done on a national scale to improve the public health sanitation in England. It was the right approach for the wrong reason. And a man named Max von Pettenkofer, who worked particularly in Germany and actually did design things in Naples after a cholera outbreak, also used the concept of miasma to do a lot of his work and did the right thing for the wrong reasons. So those things sometimes do occur. But when Max von Pettenkofer died in 1901, there really wasn't any prominent individual who was advocating for miasma or anything that is not the germ theory of disease. So when he died, it pretty much all of that died with him.
There's a few questions I ask at the end of every show of each person who comes on the show. And they're based on the premise that, and this is part of the paradigm shift, that people who work at companies are customers and that work is a product that they buy. And so I ask product marketing questions about work. And one of those questions is, what do you hire your job to do for you or your work to do for you? Your work hires you to do something for it. What do you hire it to do for you?
Well, it really goes into my decision to go into infectious diseases. And that decision was made largely at the very end of medical school. What I recognized was that as an infectious disease physician at the time, and this was in 1979, if a patient came with a urinary tract infection or pneumonia, I could cure them with an antibiotic. And that, to me, was enormously satisfying. I can remember a woman, I think it was an intern, and she was quite ill when she came in. She had a very high fever, just felt awful, and had a kidney infection. We would call that pyelonephritis. And we did all things to diagnose it. And I told her, by this time tomorrow, you're going to feel a whole lot better. And she looked at me like, you're crazy. And I came in the next day at that time, and she had this huge smile on her face. And she said, you were absolutely right. I feel much better. And that was very attractive to me. So the idea that I could cure people, because in a lot of areas of medicine, you treat people. You know, if you take care of somebody with diabetes, you treat it, but you can't cure it. Now, that was very greatly challenged for quite a while when HIV came along. And that was a more difficult issue for probably a good 10 to 15 years until we really got therapy. And again, when we got what was called highly active antiretroviral therapy, sometimes abbreviated HART, I remember seeing patients who had struggled a bit and weren't feeling great just almost magically improve. And it was very satisfying. So that's a lot of what I get out of work, is being able to do that. And infectious diseases, often that has that as an outcome. You really, and sometimes we almost get inured to it, that we can really not just treat, but cure people. And that's what I get out of it.
It must have been terrible to have a disease come along that was just beyond our ken and your ability to treat.
There were 2 times in my life where that was the case. One was HIV, and that was, as I mentioned, with the anecdote I told you about before, a very depressing time for infectious disease doctors. The other one was at the beginning of the pandemic with COVID. That was also an incredibly scary time for everybody. My job at that point was actually working with the hospital administration, trying to figure out how to handle the situation for the whole hospital, less so for individual patients. Because we may recall at the beginning of that time, there were problems with resources. We didn't always have enough masks. There were a lot of issues. And it was a period where it was one of those times where you couldn't make the right decision for everybody. No matter what you decided, somebody was upset. And that was a very difficult time. And to be quite honest, it tended to accelerate my desire to retire. I was going to retire about 2 years later than I actually did. I got through the pandemic, things were settling down, but it had taken most of the energy out of me. But that was a remarkable period that I am very hopeful we never see again. But if you know anything about infectious diseases, at some point in the next 50 to 100 years, we probably will.
Yeah. And COVID was lightweight compared to a smallpox or a syphilis or a bubonic plague or some of the historical diseases.
Absolutely correct. We were relatively lucky with COVID that it did not have the mortality rate of something like, say, smallpox. We lost, still ongoing, unfortunately, but we lost in the first 3 years probably worldwide about 7 million people from COVID. It's estimated. It might be more than that. But if it had the mortality rate of syphilis, the number probably would have been 900 million.
To some extent, you've addressed this. This is my second and last question, which is, what does your job cost you? What does your work cost you?
Well, I talked a little bit about COVID. That was an extraordinary period. No one was prepared for that. And that cost a lot. And there are many other people that had that experience, I know, from talking to folks. The situation in infectious diseases was one that, over my career, I think HIV is what changed it the most. And for a good period of time, what sort of happened in infectious diseases is there was kind of a split in infectious disease doctors. People that ended up moving into HIV work, research, clinical care, and people who went other directions, more what was the more traditional approach when I first got into it. And because of the way I was trained and my interests and what I was hired to do, I was more the latter. So I didn't get as involved with HIV. I still had a clinic and I still saw patients and I still kept abreast of what was going on, but I was not doing the primary research. And for quite a long period of time, most of the emphasis in divisions in medical schools, et cetera, was moving towards HIV because that's where the patients were coming from. And what I was doing was not as great an interest, both for research and to some extent by the administration. And I had a lot of times to justify what I was doing more so than people that worked in HIV. But there were some cycles that went on in both ends. So I think that was it. And then, as happens in any workplace, I had periods where when my boss changed, things didn't always go smoothly. And that happened at a particularly difficult time in my life, personally, as well as professionally. So that cost me a lot, but that was just sort of individual. And I wouldn't say that was what work did.
I'd say it's part of work, is who we work with. Where can people learn more about your work?
Well, to understand the paradigm shifts that I talked about, I don't think there was anything that I mentioned that is not in my book called Germ Theory, Medical Pioneers in Infectious Disease. It is published by the American Society of Microbiology and now distributed by the publisher Wiley. So a lot of places to go to get that. But that would probably be my best suggestion. There are lots of other books on the subject, but I felt that the approach that I took in the book was one where I followed the individuals who made great contributions to getting us there. And it's something that we didn't necessarily talk about, is that by following the individuals, you could sometimes see the effective personality of the individuals, either on the way they made their discovery or more likely the way they tried to convince their contemporaries that they were right. And sometimes their personalities got in the way of that. I think it's something in the workplace that we don't address very much, which is how much your personality can affect the success in your job.
That's right. There were a couple of people who were just really abrasive or secretive. And actually, some of them were secretive about their methods. They were jealous of each other sometimes, and they would be at odds, or they were abrasive, but some of them were quite lovely and everybody liked them. And they had authority because they were from the right university or they were country doctors, and people were less likely to believe them. So it was interesting to see just how much the personality matters, because that's something that those of us who are in the paradigm changing business can actually work on. And this is one of the reasons why I think the book's a really good one for people who are in the change business, who are in the business of trying to introduce new things into the world, which is that by hearing the stories, the biographies of the individuals who went through it, you can see their struggle to get it through. And sometimes they made it worse for themselves, sometimes they made it better, but almost all of them went through at least a decade of trying to influence those around them to change. And that's on the low end.
I would agree with that. I think, whether it's 10 years or not, it was rarely something that was immediately accepted and followed. And it is a struggle. And as I say, sometimes the personality of the individual makes a difference. I know Joseph Lister, I've challenged anyone to find somebody who wrote something negative about him as a person. And he was beloved as a person. And yet what he was advocating, particularly people in his own country and to some extent the United States, just fought him tooth and nail on doing it.
There is something we didn't talk about, which is the nature of resistance. And one of the patterns of resistance is you're Joseph Lister and you tell people, hey, you know what? You've been killing your patients. And I think there's a natural response to say, I would rather not believe you when you say, I've been killing my patients.
Yeah, it was one of the reasons that people didn't really want to follow it, because they had to admit that what they were doing was actually harmful to their patients. He also made the ritual in using dressings and stuff with the carbolic acid, I think, overly complicated. And he used a sprayer in the operating room, and it made the room smell pretty bad. And people didn't like it for that reason. So there was an inconvenience to it. But I think you hit on much more of the issue, which is that they had to admit that what they were doing was actually harming their patients because they were the ones that were causing the infection. And that was very, very sensitive for the surgeons as they were considering this.
I'll tell you what I hear, because I think this is a part of the premise of our show, is that a lot of current management practices are harming the patient. And going to many HR conferences where I hear people talking, I think that there were probably very serious conversations about the best way to bleed people once upon a time. Should you use a lancet or should you use leeches? And within the context of the theory at the time, that was a serious conversation that people needed to have. But a new paradigm shift in management, it implies that everything you've ever done might have been wrong.
And what's fascinating is that it wasn't until 1830 that a man in Paris named Pierre Louis, a physician, actually did what we would consider an epidemiologic study. It was one of the first, where he showed that bleeding a patient with pneumonia didn't help. And everybody's arguing, should we do it with leeches, should we do it with lancets, whatever it is. But nobody stopped to look at the fact that for 2,400 years, bleeding a patient didn't actually help. And he finally did. And that was stunning. And yet very few people know about that study.
Well, there's a management practice, which is performance management. Everybody agrees that it's necessary. And it may be useful, but there's no evidence to support that it is. There's like one study with bus drivers, but considering how ubiquitous it is, you would think that there'd be some really substantial evidence behind it. The answer is it's very hard to find. And when you do find evidence on it, it's often suggesting that it doesn't have benefits. And so it's one of these things where we all do it. It's part of the zeitgeist. And the patient believes that it's necessary, and the doctor believes that it's necessary. But there's not really very much evidence that says that it is.
And I think that's an example in what we were talking about with bleeding patients, is that it was done for so long and so accepted that nobody even thought that, well, really, are we helping people here? Well, let's look at it.
And the patients themselves were like, could you come over here and bleed me? Because this is the way curanderas work in Mexico, which is that it's very believable, symbolism that's conducted. So, not believable, compelling.
Yeah.
It's like, this might be doing some good. And I'm going to crack an egg into a bowl, and I'm going to make a cross out of some matchsticks, and I'm going to light them, and I'm going to drop them into the egg, and then I'm going to put the egg in a cup on you, and I'm going to draw out the toxin. And so it's elegant, and it's kind of beautiful, and patients want it.
Well, we talk in medicine about doing what's called the double-blinded placebo-controlled trial as the pinnacle of, does this thing work? You take whatever your treatment is and you use a sugar pill and you blind the patients and the doctors to know who's getting what. This was done in the late 80s with a drug that had evidence of effect on HIV in the laboratory. It was a drug called Suramin. So it looked like it worked in the laboratory, and this is what Rock Hudson went to Paris to get near the end of his life. They finally did a double-blinded placebo-controlled trial, and the patients that got Suramin actually died faster than the patients that got the placebo. And I've always told patients, I don't want to give you something that's going to kill you faster than if I did nothing at all. And that's the element that I think we need to be aware of when we see some of these unsupported treatments. They may be helpful, they may not be harmful, but they could be.
This is totally irrelevant to the show. I just have to mention for listeners something that Dr. Gaynes and I talked about beforehand, which is that I'm in La Jolla right now, and this all ties together. Rock Hudson's from La Jolla. Across the canyon from where I grew up is Jonas Salk's house, who invented the polio vaccine. Next door is the Simon's house, which inventors of one of the protease inhibitors. San Diego has a lot of biology, and so you sit here and you're just sort of surrounded by biology. Watson lives here, of Watson and Crick, who identified did anyway, the structure of the double helix. So it's all feels homey to me to be talking about this. Well, thank you very much for coming on the show.
My
This
pleasure.
has been fantastic. I recommend to everybody, if you're leading a paradigm shift and you want to understand why it's hard, take a look at this book. It's both discouraging in the sense that, yeah, it's going to be hard, and it's encouraging, which is that eventually these things win out. So, thank you.
My pleasure. It was great to be here.
Thanks for joining me for another episode of Work for Humans. If you enjoyed this episode, please give us a 5-star rating wherever you listen to podcasts. And share the show with one person you think would get value from it. Believe it or not, this really helps us grow the show and reach more people who want to build the kind of work that people really want. As always, thank you to my producer, Jason Ames at Ninth Path Audio, for his insights into content and his high standard for quality. Final note, the opinions shared here are my own and not the views of Google or Cisco Systems. Thanks again for listening. See you next time.